Hi, I'm Rachel Stephen-Smith. I'm the ACT Minister for Health, and I'm here with the Interim CEO of Canberra Health Services, Dave Peffer, to provide an update on the COVID-19 situation here in the ACT. Sadly, I do start today by advising that the ACT has recorded another COVID-19 related death. This is a female in her 70s. This individual was receiving end-of-life care at the Calvary Hayden Aged Care Facility prior to contracting COVID-19. On behalf of the government and the ACT community, I extend my deepest sympathies and love to this person's family and friends at this very difficult time. This brings the number of lives lost due to COVID-19 to 6 for this outbreak. Today, we have recorded 28 new cases of COVID-19 in the ACT. The total cases for this outbreak is now 1,066, with the total number of recovered cases now 663, which is 14 more than yesterday. Our team continues to manage 395 active cases, which is, of course, an increase from yesterday. 19 of today's 28 cases can be linked to known cases or ongoing clusters, with 9 still under investigation. We also know that 13 were household contacts, or are household contacts. 11 people were in quarantine during their whole infectious period, and 5 people spent some time in the community for at least part of their infectious period and may present a risk of transmission to others. To 8 p.m. last night, there were 16 people in our hospitals. 11 of these are unvaccinated and 5 have had 1 dose of a COVID-19 vaccine. We have 7 people in the intensive care unit these range in age from their 20s to their 60s. 4 of these individuals are requiring ventilation. So I think those hospital statistics highlight again the absolute importance and value of being fully vaccinated against COVID-19. So I am pleased to say that we have reached a major milestone in our vaccination rollout today, with more than 95% of Canberrans aged 12 and over now having had 1 dose. And we've passed 66% fully vaccinated. Yesterday, there were 4,445 tests conducted across the ACT, which is a fantastic number, so thank you again to everyone who's coming forward and getting tested. This is a really good level of surveillance across the territory. Again, if you think you have even the mildest symptoms of COVID-19, if you have a runny nose, a cough, a sore throat, a bit of a fever, shortness of breath, absolutely come forward and get tested. In a quick compliance update, yesterday ACT Policing conducted 83 in-person compliance checks of homes, hotels and businesses and stopped 417 drivers to speak with them about the current health orders. 1 person was directed to leave the ACT, 2 infringements and no cautions were issued. Unfortunately, I do have a bit of an update in relation to Canberra Hospital, or particularly the Centenary Hospital for Women and Children. A baby in the special care nursery at the Centenary Hospital for Women and Children has tested positive to COVID-19 overnight. The patient has been in the special care nursery for some time and became symptomatic last night. The child has been moved to a COVID-19 ward and family members have been advised to get tested and to enter quarantine. Team members and other families who are assessed as either at high risk or moderate risk of exposure are also being contacted and advised to get tested and to quarantine. The CHS Canberra Health Services COVID exposure team is conducting a full risk assessment this morning, and we know that they have done this many times before. This will include liaising with the families of patients who may have been discharged from the special care nursery in recent days. CHS is liaising with ACT Health's public health team around potential related exposure sites outside of Canberra Health Services. Coordinating testing of patients, families and staff will continue today. Enhanced infection prevention and control measures and protocols have been put in place to further minimise any risk, and impacted areas, of course, are being deep cleaned. Canberrans can be assured that this situation is being expertly handled, and they can absolutely feel safe again to attend hospital should they require that level of care. And again, this is something that our Canberra Hospital and Canberra Health Services team have done many times now, as we've seen positive cases of COVID-19 identified within the hospital setting. Some news on the ACT budget, which is of course being delivered today. Well, we're investing more funding through the 21-22 ACT budget to ensure we can continue the government's effective public health response as we move through the phases of the ACT's pathway forward. The ACT government is investing more than $90 million to continue the COVID-19 public health response and push forward with the vaccine rollout. Almost $65 million of this will be allocated to manage the impact of the virus on the ACT community and provide the Chief Health Officer the support she needs to continue her excellent advice and response to the pandemic. The ACT Hardship Fund has also been extended for 12 months to the 30th of June 2022 to ensure that Canberrans who are temporarily unable to work under a COVID-19 direction or health guidance are not left behind. Beyond this, a $500 million boost will be provided over 4 years in the 21-22 budget to enhance resourcing in response to growing demand for core services across the ACT public health system and to reflect the increased complexity of health service delivery. Our teams across the ACT government and in the community sector have been doing an incredible job responding to the pandemic. But we know that demand for new and expanded health services has only been increasing over recent years. We've worked extremely hard to get as many people vaccinated as possible and will continue the rollout until everyone in the ACT who wants to be vaccinated has the opportunity. We're providing extra funding for the ongoing COVID-19 response and vaccine rollout to protect our community and guide Canberra along the pathway out of the lockdown. But before I finish up today, and in the absence of the Chief Health Officer or her deputy, I'd like to give a shout out to the Digital Solutions Division of ACT Health. Throughout the pandemic, this team has risen to the challenge to put in place new technologies to support our COVID-19 response. They are the creators and developers of so many of the digital systems that have been critical to our success and that we rely on, including the Check in Canberra app, of course. They also run the MyDHR online booking system and the phone booking system for the COVID-19 vaccine program here in the ACT, which has seen thousands, hundreds of thousands of Canberrans booked for vaccinations. So thank you to all of the teams within the Digital Solutions Division who have contributed to this response.